Hey there and welcome. Today we're diving into something that honestly sounds a little bit out there, craniosacral therapy, or CST for short. The whole idea is that a touch, a really, really light touch, can actually create huge changes deep inside your body. It sounds kind of crazy, right? So how on earth is that supposed to work? Let's dig in and find out.
And yeah, that really is the million-dollar question, isn't it? It just goes against everything we think we know. I mean, a touch as light as a feather affecting your brain and your spine? How? It seems impossible. But stick with me, because we're about to unpack the whole thing. The theory, what actually happens in a session, and what science has to say about it all. All right, so first things first, let's get right down to it. What are we actually talking about here? What's the core idea behind this gentle yet supposedly powerful touch? Okay, so fundamentally, CST is a type of hands-on therapy. But you've got to forget everything you know about deep tissue massage. This is different. It zeroes in on something super specific, that whole system of membranes and fluid that surrounds and protects your brain and spinal cord. And the philosophy here isn't about fixing you. It's more about unlocking your body's own amazing ability to heal itself. It's about creating the right conditions for that to happen. And get this, 5 grams, that's it. That is the amount of pressure we're talking about. To put that in perspective, that's literally the weight of a nickel. A practitioner uses this unbelievably light touch, not to force anything to move, but to listen. It's about using their hands to feel for these really subtle restrictions in your system. It's less about doing and more about listening. So you're probably wondering, where in the world did this idea come from? A light touch, a hidden rhythm. It sounds almost mystical. To get it, we've got to rewind a bit and look at where it all started. Okay, so the story starts way back in the early 1900s with an osteopath, a Dr. William Sutherland. Now, he came up with this pretty wild idea for the time. He believed the bones in our skull weren't just fused solid like a helmet. He thought they had this tiny rhythmic movement. Flash forward to 1970. Another doctor, John Upledger, is in surgery and he sees it. He actually observes this rhythm in the membranes around the spinal cord. And that one moment, that observation, was the spark that eventually grew into the craniosacral therapy we know today. And this is the system we're talking about. See, it's not just about your head. The name itself, craniosacral, gives you a clue. It connects your skull, your cranium, all the way down to your tailbone, the sacrum. It's all connected by this tough membrane called the dura mater. Think of it like a single continuous system. So the theory goes, if you have a restriction or a jam somewhere in that system, it can throw the whole thing off, from top to bottom. And this is that rhythm they were talking about. The theory is that the cerebral spinal fluid, the stuff that cushions your brain and spine, is constantly being produced and reabsorbed. And that process creates this super subtle pulse, kind of like a tide that flows at about 6 to 12 cycles every minute. That is the quiet, hidden rhythm that practitioners are trained to feel with that 5-gram nickel weight touch. Okay, so that's the backstory, but what's it actually like to get a CST session? What can you expect if you're the one on the table? Let's walk through it. So a session is usually about an hour long, and good news, you get to keep all your clothes on. You'll start by chatting with a therapist about what's going on with you. Then they'll have you lie down and they'll gently place their hands on you, maybe on your head or your torso or down by your tailbone. And just to be clear, they're not cracking anything or digging in with their elbows. They're just palpating, which is a fancy word for feeling. They're listening for that rhythm. And if they feel a spot that seems stuck, they'll use these super gentle techniques to kind of invite the tissue to release on its own. Most people say it feels incredibly relaxing, almost like a deep meditation. And that's really the whole point. The goal is super simple when you think about it. Just release those little restrictions so your body can do its job better. The therapist isn't the hero here. Your body is. They're just the facilitator, kind of like someone helping you untangle a tricky knot. Once the knot's gone, your body can get back to its main business, regulating and healing itself. Okay, now we have to talk about the elephant in the room. Because as interesting as all this is, CST is, well, it's pretty controversial. So let's dive into the science, or lack thereof, and the big debate around whether any of this actually works. So you've basically got 2 camps here. On one side, you have proponents who say, look at all the people who feel better. It clearly helps with pain and stress. They believe it works by calming the nervous system down. But on the other side, you have the critics, and they have some really serious questions.
They say, wait a minute, adult skull bones are fused. They don't move. They ask, if this rhythm is real, why can't our instruments measure it? And they suggest that maybe, just maybe, the benefits people feel are really the placebo effect, that feeling better comes from an hour of relaxing, focused, gentle touch. So what does the actual research tell us? Well, it's complicated. It's a mixed bag. There were some studies that show that yes, experienced therapists seem to be able to feel something with a decent amount of consistency between them. And some reviews of existing studies suggest it might have some benefit for things like pain and anxiety. But, and this is a big but, pretty much everyone in the scientific community agrees that we're missing the big, high-quality, large-scale studies you'd need to say for sure one way or the other. The jury is still very much out. But even with all that debate, people are still seeking out CST for all sorts of things. You can see a pattern here, right? A lot of these conditions, headaches, chronic pain, stress, anxiety, they're all tied up with the nervous system being out of whack. So for people dealing with that kind of stuff, the idea of a really gentle approach to calm everything down, well, you can see why that's so appealing. Now, this is really, really important. Even though CST is super gentle, it is absolutely not for everyone. There are some serious situations where you should avoid it, period. Anything where there might be pressure on the brain, we're talking recent skull fractures, brain bleeds, aneurysms, it's a definite no-go. Safety has to come first, always. So let's pull all of this together. We've looked at the history, the practice, the controversy. So what's the bottom line? How should we really think about this therapy? You know, I think this quote really nails it. CST kind of lives in this gray area, this bridge between science and something a bit more subtle. It has roots in actual anatomy and osteopathy, but the practice itself relies on a type of feeling and perception that, frankly, our scientific instruments just aren't great at measuring yet.
And maybe that's why it's so popular, despite the questions. We live in a world of pretty intense, sometimes invasive medical treatments. CST is the opposite of that. It's gentle, it's non-invasive, and it's all about you. For people who've tried everything for their pain or stress and nothing's worked, an approach that's all about deep relaxation and helping the body help itself, well, that can be a really powerful thing.
So it all kind of leaves us with this one big final question to chew on, doesn't it? When it comes to healing, what's more important? Cold, hard scientific proof or your own personal experience? How do we balance those two things? It's a tough question, and it's way bigger than just this one therapy. Definitely something to think about. Thanks for tuning in.